As we age, many conversations become increasingly difficult to have. Some topics feel off-limits, wrapped in shame, stigma, or simple discomfort. One of the most hushed subjects among seniors is self-intimacy, specifically masturbation. Yet what few realize is that this quiet avoidance carries profound consequences far beyond sexual pleasure. It's not simply about desire. It's about biology, brain function, emotional health, physical strength, and even our immune defenses. For decades, I've sat with patients in their 60s, 70s, and 80s who came to me confused, ashamed, or simply unaware of the changes happening within their bodies. They weren't struggling with diseases as much as they were quietly eroding from neglect of a part of their body they thought no longer mattered. But the truth is stunningly simple. Self-intimacy remains one of the most powerful tools for health preservation in older age. When it disappears, a series of silent declines begin, touching every corner of life. In this journey, we will expose 7 dangerous consequences that can sneak into your life when self-intimacy is abandoned. These aren't theoretical or rare. They're real, well-documented physiological effects that many seniors face without ever realizing the root cause. You'll learn why this seemingly small habit matters so profoundly for your prostate and urinary health, mental clarity, emotional stability, sleep quality, muscle strength and circulation, immune system, self-worth, and identity. If you or a loved one are navigating the later chapters of life, this information might just transform the way you approach aging itself. Because in the end, aging isn't about surrendering. It's about maintaining control over your body, mind, and dignity for as long as possible. Let's begin this revealing journey together. Silent Consequence 1. The Prostate Trap. How neglect silently destroys your urinary freedom. As we venture into the quiet corners of aging, there is a truth few dare to speak aloud, a truth that hides behind closed doors and polite silences. When seniors stop engaging in masturbation, one of the earliest organs to suffer is often the most underestimated, the prostate. This tiny gland, no bigger than a walnut, holds the keys to so much more than we give it credit for. The silent guardian of masculine health. For decades, the prostate quietly performs its duty, producing seminal fluid that nourishes and transports sperm. It expands and contracts rhythmically with each ejaculation, much like the lungs with every breath or the heart with every beat. But unlike the heart and lungs, which function automatically, the prostate requires intentional stimulation to stay vibrant. In younger years, frequent sexual activity ensures the prostate stays active, regularly flushing out stagnant fluids. But as many seniors age, especially after losing a spouse or retreating from sexual intimacy due to cultural taboos or health concerns, this rhythm halts. The gland, left unstimulated, becomes stagnant. The fluid within thickens. The walls begin to swell. Stagnation breeds trouble. This stagnation is not harmless. It becomes the breeding ground for inflammation, congestion, and swelling. As the gland enlarges, it begins pressing against the urethra, the very channel through which urine flows. Slowly but steadily, a cascade of discomfort emerges. Frequent nighttime urination, weak urinary stream, a persistent feeling of incomplete emptying, sudden, urgent needs to urinate that disrupt daily life. This isn't just a nuisance, it's a loss of freedom. The man who once took long drives now plans routes based on bathroom locations. The retiree who enjoyed leisurely strolls now worries about sudden urges that might strike. The freedom to move, to socialize, to live unburdened is quietly stolen. The darker progression left unchecked, this seemingly minor congestion can spiral into far more serious territory. Benign prostatic hyperplasia, BPH. Affecting nearly half of men over 60, BPH can progress to severe urinary retention, catheter dependence. Some seniors reach a point where they can no longer urinate naturally. Bladder infections. Stagnant urine invites bacterial growth, compounding suffering. Surgical intervention. Many require invasive surgeries to relieve pressure, a costly, painful consequence that may have been avoidable. The scientific defense of ejaculation emerging studies. back up what many urologists have quietly observed for years. Men who ejaculate at least 21 times per month have a significantly lower risk of developing prostate cancer compared to those who ejaculate less frequently. It's not about sexual indulgence, it's biology. Ejaculation flushes out old fluids, stimulates blood flow, keeps the tissues oxygenated, and prevents cellular buildup that can tip into malignancy. The loss of dignity. Beyond physical discomfort, there lies a quieter heartbreak, the loss of independence. The man who once stood tall becomes ashamed of unpredictable leaks. The husband who once exuded quiet confidence now fears intimacy, afraid his bladder may betray him. The grandfather who once played with his grandchildren now hesitates to join long outings. Each symptom chips away at identity, at dignity, at the ability to live life fully. What begins as a physical issue quickly metastasizes into an emotional wound. The way forward. The most tragic part. Much of this is preventable. Gentle, regular self-stimulation isn't vulgar. It's responsible. It's a form of care as natural as brushing teeth or exercising joints. It maintains prostate flexibility. It keeps urinary function steady. It shields against chronic swelling. In many ways, it's one of the simplest, safest ways an aging man can preserve his quality of life without expensive medications or invasive procedures. Silent consequence 2. The cognitive fog. How neglecting self-intimacy dulls the aging brain. Aging is often accompanied by certain expected shifts, slower recall, misplaced keys, forgotten names. We accept these changes as normal. But what if I told you that for many seniors, these early signs of mental fog aren't merely about getting older. They're about neglecting one of the most profound forms of self-care, physical intimacy with oneself. The brain's delicate chemical orchestra. Every time we engage in intimate self-touch, something remarkable unfolds inside the brain. A silent biochemical symphony of neurochemicals floods our system. Dopamine, enhancing focus, motivation, and reward. Serotonin, stabilizing mood and emotional balance. Oxytocin, deepening feelings of connection and calm. Endorphins, natural painkillers and mood elevators. These aren't fleeting feel-good chemicals. They play central roles in regulating memory, executive function, concentration, emotional regulation, and even creativity. This chemical surge is nature's built-in neurological tune-up. But when masturbation disappears from an aging adult's routine, the symphony begins to quiet. Gradually, the sharp notes of clarity dull into a heavy, low fog. The slow descent into mental dullness. The loss of regular neurochemical stimulation doesn't show up overnight. It's stealthy, deceptive. First, you lose a name on the tip of your tongue. Then, you forget why you entered a room. Eventually, conversations blur. Concentration slips. Decision-making feels harder. Emotional flattening follows. Nothing excites you, but nothing deeply saddens you either. The person who once solved puzzles, read books, led conversations, begins to feel blank. And tragically, they often assume it's simply old age. The hormonal link. For men in particular, there's another sinister layer beneath. Testosterone decline. Regular sexual stimulation helps maintain balanced testosterone levels. Testosterone isn't just about libido. It's about drive, decisiveness, memory, and identity. Without it, mental sharpness fades faster, confidence dwindles, motivation drains. This decline isn't inevitable. The absence of physical intimacy accelerates it. I've sat across from men who once led boardrooms and now struggle with simple scheduling, not because their intellect has vanished, but because their hormonal and neurological systems have been deprived of stimulation. Anxiety and depression. The hidden twin shadows. When this cognitive dullness sets in, many seniors begin to fear the worst. Am I developing dementia? Is this early Alzheimer's? That fear often triggers anxiety, which ironically makes memory and cognition even worse. As emotional regulation falters, many quietly spiral into depression, sometimes without even realizing it. The deep tragedy? Much of this might be preventable through one of the most natural, private forms of self-care still available to them: The revival is possible. The good news is the brain remains remarkably plastic, even in later life. Reintroducing regular, safe self-intimacy can rekindle those chemical surges. Dopamine pathways reignite. Serotonin balance returns. Cortisol levels, the destructive stress hormone, fall. Confidence quietly returns. I've seen patients in their late 70s and 80s describe a profound mental awakening, not from pills, not from endless cognitive therapy sessions, but from simply reconnecting with their own bodies. One retired teacher once said to me, after 3 months of intentional self-care, "Doc, I can think again. My mind feels like it belongs to me again. It's not magic. It's neurobiology, finally receiving the stimulation it quietly craved for years." Silent consequence 3. Emotional numbness, the quiet descent into depression. When self-intimacy fades in youth, emotions are vibrant. Joy feels electric, sadness cuts deeply, love surges through our veins like fire. But as the years roll on, many seniors find their emotional world flattening. The once colorful spectrum of feelings fades into muted grays. And disturbingly, many assume this numbness is simply a normal part of aging, but it's not. Often, this emotional flattening stems not from age itself, but from the silent neglect of one's intimate connection to the body's forgotten emotional release valve. Masturbation is often misunderstood, reduced to mere pleasure or dismissed as a juvenile act. But beneath the surface, it serves a profound emotional function. It releases oxytocin, the bonding hormone that soothes anxiety and creates a sense of calm. It floods the brain with endorphins, the body's natural antidepressants. It balances serotonin, stabilizing mood and regulating sleep cycles. It clears cortisol, lowering stress and calming the nervous system. In youth, sexual expression naturally provides this chemical release, but as intimacy fades in older years, often due to the loss of a partner, shame, or cultural taboos, the emotional relief valve closes. What follows isn't always dramatic sadness. Instead, it's something much more insidious: emotional numbness. The numb zone, neither joy nor pain. This emotional dead zone isn't sadness in the way we typically understand it. You don't cry often. You simply don't feel much of anything. Laughter becomes rare. Joy feels distant. Enthusiasm for hobbies dwindles. Even small pleasures, a cup of tea, a favorite song, a family visit, lose their spark. Life becomes grey, predictable, empty. This isn't aging. It's emotional starvation. The loneliness amplifier. Worse still, emotional numbness quietly feeds loneliness. When you no longer feel deeply, you withdraw. When you withdraw, social bonds weaken. When bonds weaken, loneliness grows. When loneliness grows, depression deepens. When depression deepens, numbness tightens its grip. It's a vicious, self-perpetuating cycle. Many seniors trapped in this cycle don't recognize they're experiencing depression. Instead, they call it just part of getting old. But it isn't. It's a physiological domino effect triggered, in part, by the absence of emotional and physical intimacy, grief, loss, and the withering touch. For many seniors, the loss of a spouse becomes the trigger. They stop touching themselves because it feels wrong after their partner is gone. Months turn into years. Self-intimacy is abandoned entirely. With it goes one of their body's last built-in tools for emotional regulation. I've heard countless widows and widowers say, "Since they passed, I haven't touched myself once." And with that admission often comes the quiet confession that they feel more lost, more detached, more invisible than ever. The dangerous myth: I'm too old for this. One of the greatest cultural lies surrounding aging is the belief that sexual or self-intimacy is only for the young. This belief is not just wrong, it's dangerous, because as self-intimacy disappears, emotional vitality fades with it. The brain still craves oxytocin, the nervous system still hungers for release, the body still needs its emotional reset button. At 40, at 60, at 80, the healing power of reconnection. When seniors reclaim safe, healthy, private self-intimacy, profound shifts happen. Color returns to emotion. Interest in hobbies revives, conversations deepen. The spark of aliveness reignites. I've seen patients who haven't felt joy in years rediscover simple happiness, not from medication, not from therapy, but from reconnecting with their bodies. One woman in her early 70s, after months of gentle encouragement, shared, "I didn't know I could still feel like this. I thought that door was closed forever." It wasn't closed. It was locked by fear, shame, and silence, but the key had always been in her hand. Silent consequence 4. Sleep deprivation. How the loss of self-intimacy quietly steals your restorative sleep. In the stillness of the night, many seniors lie awake, staring into the darkness, restless, frustrated, exhausted. They may chalk it up to just getting older or natural changes in sleep. But beneath this surface explanation lies a hidden biological truth. The absence of self-intimacy can silently rob you of the deep healing sleep your body so desperately needs. Sleep is not just about closing your eyes. Sleep is a masterfully orchestrated symphony of hormones and brainwaves. It's not simply turning off the lights and lying still. To drift into restorative sleep, your body must first achieve a drop in cortisol, the stress hormone, a rise in oxytocin, endorphins, and prolactin, slower, deeper breathing, a calm, relaxed parasympathetic nervous system, and one of the most natural triggers for this sleep-inducing cascade, orgasm, the biochemistry of release. During sexual climax, whether with a partner or through masturbation, your body floods itself with neurochemicals specifically designed to induce relaxation. Oxytocin promotes feelings of bonding and emotional safety. Prolactin creates a wave of post-orgasmic drowsiness. Endorphins soothe both physical and emotional tension. Cortisol levels plummet, allowing the mind to unwind. Dopamine provides a sense of satisfaction and reward. This chemical cocktail is nature's original built-in sleep aid, without side effects, without prescriptions. The insomnia that slowly creeps in. When self-intimacy fades with age, many unknowingly shut off this natural process. The result? Frequent night wakings, difficulty falling asleep, shallow, fragmented sleep cycles, early morning awakenings that feel like torture. Many seniors describe the same story. "I fall asleep fine but wake up suddenly at 2 or 3 a.m. and can't get back to sleep." What they don't realize is that their body has lost its internal sleep trigger mechanism. Without regular physical release, cortisol remains elevated, the mind races, muscles stay tense, the nervous system never fully shifts into rest mode. The domino effect of poor sleep. This isn't just about feeling groggy the next day. Chronic sleep deprivation quietly unleashes an avalanche of problems. Cognitive decline, memory lapses, confusion, slower thinking, mood instability, increased risk of depression and anxiety, weakened immunity, frequent infections, and slower healing. Higher risk of falls. Drowsiness reduces balance and coordination. Heart strain, elevated blood pressure and cardiovascular risk. Loss of independence. Fatigue limits daily function and social engagement. I've seen proud, once active seniors withdraw from life simply because they were too exhausted to engage, not realizing that part of their sleep problem stems from neglecting self-intimacy. Misplaced solutions make it worse. Unfortunately, most turn to sleeping pills, which often fail to address the root issue, alcohol, which disrupts REM sleep, resignation, it's just old age. But few ever hear the truth from their doctors. Perhaps your body is missing one of its most ancient self-healing rituals, the rediscovery of sleep through self-connection. Time and again, I've witnessed remarkable turnarounds. Seniors who had struggled for years begin reconnecting with safe, private self-intimacy. Gradually, their sleep improves, longer, deeper, more restorative rest. Mood lifts, energy returns, cognitive clarity sharpens, their quality of life blooms again. One patient in his late 60s told me, "Doctor, I feel like I'm finally sleeping like I did in my 30s. I had no idea how much my body needed that release." Because it isn't simply about sexual desire. It's about physiological maintenance, about keeping the engine running smoothly, about restoring what nature once built into our design. This is not indulgence, this is healthcare. We must strip away the shame, the embarrassment, the misguided belief that self-intimacy is only for the young. In truth, It's one of the few drug-free, side-effect-free tools seniors still possess to promote deep healing regenerative sleep. A rested body fights disease. A rested mind remembers better. A rested heart loves longer. Silent consequence 5. Weakened pelvic floor and blood circulation. The silent collapse of your core. As the body ages, few areas suffer more quietly than the muscles we never think about, the pelvic floor. This network of muscles, ligaments, and connective tissue sits like a hammock at the base of your core, silently supporting some of your most vital functions: bladder control, bowel function, sexual performance posture, and spinal stability. But when self-intimacy disappears, when you stop stimulating this region through sexual release, these muscles are left unstimulated, neglected, and vulnerable to gradual breakdown. The pelvic floor, the forgotten foundation. You can't see your pelvic floor, you rarely feel it at work, yet every time you laugh, sneeze, stand up, empty your bladder, engage in sexual activity, you're calling upon these muscles to engage, contract, and support your organs. But as self-stimulation declines with age, these muscles lose their rhythmic contractions that kept them strong for decades. Orgasm, especially through masturbation, acts as a natural exercise routine for your pelvic floor. The rhythmic contractions during climax strengthen muscle fibers, maintain neuromuscular coordination, boost blood flow, preserve elasticity, sustain nerve sensitivity. When you stop this process for months or years, what follows is an invisible atrophy. The gradual erosion. You don't notice until you do. At first, there are no symptoms. Then, small frustrations emerge, dribbling after urination, frequent urges to pee, mild incontinence while sneezing or laughing, difficulty holding gas or bowel urgency, tightness or pain during sexual activity. For many men, this leads to weaker erections, shorter duration of sexual performance, decline in sensitivity. For many women, it results in vaginal dryness, painful intimacy, loss of sexual desire entirely, and the tragedy. Most seniors connect these problems to something as simple as loss of pelvic floor engagement due to absent self-intimacy. They assume it's just old age. My body's breaking down naturally. But often it's not simply aging. It's disuse. The circulation crisis. Just as muscles weaken, blood flow diminishes. When sexual activity stops, the pelvic region receives less oxygen-rich blood. Tissues stiffen. Nerve endings lose sensitivity. Healing slows. This reduced circulation doesn't just affect the pelvic floor, it compromises heart health, vascular function, hormonal distribution, immune defense, wound healing capacity. Your lower body becomes starved of life-giving circulation, accelerating physical decline in ways most people never suspect. The heartbreaking result. I've watched formerly strong independent seniors slowly lose control over their bodies, avoiding social outings due to fear of accidents, wearing pads or diapers to hide leakage, planning every trip around bathroom availability, withdrawing from physical intimacy entirely. But what breaks my heart most is the loss of dignity. Many seniors, who were once vibrant, sexually alive and confident, now live with quiet embarrassment, ashamed of functions they once took for granted, and all because no one told them how critical continued pelvic stimulation is for maintaining this area. The hidden link to dangerous falls. The pelvic floor isn't just about bladder and bowel, it's central to balance and posture. When this core weakens, stability decreases, falls increase, hip fractures skyrocket, loss of independence accelerates. A simple stumble that would have been minor years ago can now spiral into hospitalizations, surgeries, and permanent disability. Again, most seniors don't connect this to their declining sexual activity, yet the physiological link is direct and undeniable. The truth no one tells you. Sexual stimulation, including masturbation, isn't about chasing youthful pleasure. It's about preserving function. It's about keeping circulation flowing, keeping muscles contracting, keeping nerves firing, keeping tissues elastic. Every orgasm is like sending an urgent signal to your lower body. Stay alive, stay strong, stay active. Without that message, the core begins to collapse from within. The good news, it's never too late. Here's what I tell my patients even in their 70s, 80s or beyond. You can rebuild pelvic floor strength. You can restore circulation. You can reclaim confidence. How? Gentle self-stimulation, pelvic floor exercises, Kegels, regular walking or low-impact core activities, staying sexually curious and connected with yourself or a partner. I've seen remarkable turnarounds. Men regaining bladder control, women rediscovering comfort and intimacy, couples reigniting connection, all starting with permission to honor this forgotten part of their health. Silent consequence 6. Lower immune function. How abandoning intimacy quietly weakens your body's defenses. Most people don't associate sexual activity, especially masturbation, with immune function. They think of it as something purely recreational, even optional. But biologically, it's anything but optional. As we age, our immune system naturally weakens. T-cell production declines. White blood cells slow down, inflammation rises. The result? We get sick more often. Recovery takes longer. Chronic diseases escalate. What many seniors fail to realize is that intimacy, including self-intimacy, plays a direct role in supporting the immune system. The biochemical symphony of sexual release. Each time you reach orgasm, your body releases a surge of critical immune-boosting agents. Immunoglobulin A, IgA, the body's first line of defense against respiratory infections, colds and flus. Natural killer NK cells, the body's cancer surveillance system that seeks out and destroys abnormal cells. Endorphins, natural painkillers and anti-inflammatory agents. Oxytocin and serotonin, stress reducers that protect against immune-suppressing cortisol overload. These are not minor players. They are the exact biological tools your aging body desperately needs to fight infections, reduce inflammation, heal wounds, lower cancer risk, slow autoimmune damage. Every time you stimulate your body, you activate this built-in healing laboratory. The invisible decline. Now imagine eliminating this process from your life for months, years, even decades. No surge of IgA. No regular endorphin boosts. Cortisol accumulates unchecked. Inflammatory markers rise, cellular repair slows. Your body's protective walls crumble brick by brick, silently, without any dramatic warning. Instead, you start noticing more frequent colds, lingering respiratory infections, slower wound healing, increased joint pain from unchecked inflammation, elevated risks of chronic illness like diabetes, cardiovascular disease, and cancer. The connection between these seemingly unrelated outcomes: a suppressed immune system that's been robbed of one of its simplest, most natural forms of stimulation. Case after case, a pattern repeats. I've seen it repeatedly with my elderly patients. The widower who stopped touching himself after his spouse passed away, suddenly battling constant bronchitis. The woman who abandoned sexual self-care, noticing strange skin rashes and chronic fatigue. The once active senior who gave up intimacy entirely, now facing one urinary tract infection after another. When we explored their health histories, one common thread emerged. Their immune systems began faltering around the same time they disconnected from their sexual selves. The domino effect of immune suppression. What's even more insidious is how this weak immunity triggers a vicious cycle. You get sick, you feel more fragile, you withdraw further, you stimulate your body even less, your immunity weakens further. The longer this continues, the harder it becomes to break the cycle. What began as a temporary pause in intimacy snowballs into chronic illness, emotional isolation, premature physical frailty. The science is clear and ignored. In numerous studies, seniors who maintain even occasional sexual activity, including masturbation, demonstrate stronger immune markers, lower inflammatory markers, higher overall life satisfaction, better resilience against infections. And yet, this simple truth remains taboo, swept under cultural carpets of embarrassment and shame. We encourage the elderly to take vitamins, eat their greens, and exercise. But almost no one dares to say, Have you stayed connected to your body lately? Have you honored your natural intimacy? Yet this may be the most underutilized form of preventive medicine available. It's never just about sex. Let's be clear. This isn't about chasing sexual pleasure for vanity or nostalgia. It's about survival. It's about giving your body the gentle, natural signals it needs to. Keep fighting, keep repairing, keep defending. Even a few minutes of self-stimulation once or twice a week can have profound systemic effects. Lower stress hormones, activate protective antibodies, promote better sleep, which itself strengthens immunity, stimulate circulation, feeding immune cells throughout the body. The unspoken cost of shame. What breaks my heart most is how many seniors suffer in silence, not from physical inability, but from internal shame. They believe, I'm too old for that now. It's dirty or selfish at my age. I don't need that part of my life anymore. And so they rob themselves of one of the most powerful natural healing mechanisms still available to them. When you stop touching your body, you stop nourishing your body. The invitation back to health. I tell every patient who struggles with chronic infections, inflammation, and fatigue, before we load your cabinet with pills, before we blame your declining age, let us first check if you've abandoned one of nature's most powerful immune activators. You may not need more medicine. You may simply need permission to reconnect with your body, to honor your biology, to embrace intimacy as self-care. And in doing so, you may discover your colds lessen, your energy returns, your body becomes resilient once more. Silent consequence 7, loss of body ownership and self-worth. As we grow older, there's a silent loss that too many people experience, but few have words to describe. It's not just the aches or wrinkles or slower steps. It's something far more intimate. It's the slow erosion of our connection to our own bodies. And at the core of this quiet tragedy is what happens when self-intimacy fades away completely. I remember a man in his late 70s, a retired school principal. He had once been sharp, decisive, full of life. But as he sat in my office, his shoulders were slightly hunched, his voice softer, and his eyes dimmer than the man he used to be. At one point in our conversation, he looked at me and quietly said, "I don't feel like I live inside my body anymore. It's like I'm just occupying it." That sentence struck me deeply because it reflects what so many seniors feel but never dare to say. When people stop engaging with their own bodies physically, even gently, they begin to feel emotionally distant from themselves. They stop seeing their bodies as part of who they are. The touch that once grounded them in the present moment disappears, and without that touch, a gap forms, a gap between the mind and the body, between identity and existence. Self-touch is not just about sexual pleasure or physical gratification. It's about reminding yourself that you are still alive, still worthy, still present in your own skin. Every time you touch your own body, you send powerful signals to your nervous system. I am here, I matter, my body is still mine. Without this, seniors often begin to neglect not just intimacy, but everything connected to personal care. They stop exercising. They stop dressing with intention. They stop looking in the mirror. The thought slowly creeps in. Why bother? This body isn't really mine anymore. I've seen vibrant women who, after menopause, stopped all forms of self-intimacy. One woman once told me, after menopause, I didn't feel like a woman anymore, and the less I touched myself, the more invisible I became, even to myself. That word, invisible, echoes through so many of my patients' stories. It's not just about fading from the world, it's about fading from themselves. When you stop engaging physically with your own body, you risk losing your sense of identity. You begin to feel like an observer rather than an inhabitant of your own life. And that disconnection doesn't just affect your mood, it affects your confidence, your dignity, your very will to keep living fully. You stop feeling like a participant in life, and instead become a passive passenger, drifting day by day, waiting for time to pass. But it doesn't have to be this way. Reclaiming self-intimacy is not about chasing youth or replicating what you did at 20. It's about acknowledging that your body still belongs to you, that you still have the right to feel pleasure, to feel sensation, to feel alive. Even a simple act of touching your own skin with care and presence sends a profound message to your brain and your heart. I have not abandoned myself. It's an act of self-compassion. It's an act of self-respect. It's an act of healing. In reconnecting with your own body, you don't just restore sensation, you restore identity. You start dressing with more care, standing a little taller, meeting your own gaze in the mirror with pride instead of avoidance. You begin to reclaim your dignity, your vitality, and your sense of belonging to yourself. Because aging should never mean disappearing. Aging should never mean surrendering your body. Your body may change, but your right to feel, to touch, and to inhabit your skin remains sacred at every stage of life. I have seen patients who, after years of disconnection, began to reclaim their self-touch gently, intentionally. And I have seen them return to life. Their eyes brightened, their energy returned, their confidence blossomed once again, not because they reversed aging, but because they restored their relationship with themselves. In the end, the greatest consequence of abandoning self-intimacy is not the loss of sexual pleasure, it's the loss of self. But you can reverse it, you can reclaim it, you can come home to your own body. And that, more than anything, is the true secret to aging with dignity, with grace, and with joy. As we reach this final reflection, I want you to pause for a moment and take in the full weight of what we've explored together. Because this is not simply a discussion about sexuality or physical pleasure or the private rituals of aging. This is something far deeper. This is about the quiet choices we make in the privacy of our own lives, choices that ripple through our health, our minds, our hearts, and ultimately, our very sense of who we are. We've seen how abandoning self-intimacy leads to 7 silent consequences. The prostate grows congested and inflamed, quietly setting off urinary problems that rob you of comfort and freedom. The brain fog thickens, as vital chemicals that once sharpened your focus slowly fade, leaving you feeling detached from your own mind. The emotional numbness settles in, not as obvious sadness, but as a dullness, a flattening of joy, of sorrow, of feeling itself until you barely recognize yourself. The nights grow longer, your sleep fragmented and restless, your body unable to find that deep healing rest it so desperately craves. The pelvic floor weakens, your circulation slows, your body's foundation quietly crumbles, leading to leaks, instability, and a growing fear of losing control. The immune system falters, once strong and resilient, now fragile and vulnerable, unable to fend off the simplest of illnesses as it once did. And finally, the deepest cut of all, you begin to lose your sense of ownership over your own body. You stop feeling present within yourself. You disappear not from the world, but from your own reflection. This is not the natural course of aging. This is not a fate that we must accept. The greatest tragedy of these consequences is that they are not inevitable, they are not irreversible. They are the result of silence, shame, and outdated beliefs that tell us that sexuality has an expiration date, that after a certain age we must give up this part of ourselves, that to touch our own bodies is somehow inappropriate, indulgent, or unnecessary. But nothing could be further from the truth. Your body still listens, your body still responds, your body still longs for connection, connection not only with others, but with you. Masturbation in later life is not about chasing youthful lust. It is about circulation, it is about preserving brain function. It is about stabilizing your mood, fortifying your immune system, strengthening your muscles, and above all, honoring the life that still pulses within you. This is about reclaiming ownership of your body, and with it, reclaiming your vitality, your independence, and your dignity. And here's the beautiful truth. It does not require anyone else. It does not require perfect health. It only requires you to give yourself permission to reconnect, to say, I still matter, to say, I still deserve to feel, to say, I am still alive. I have walked this road with countless men and women over my career. I have seen the transformation when they give themselves permission to reclaim their intimacy, and I have seen the light return to their eyes, not because their bodies became young again, but because their spirits did. So if you've listened this far, know this. It's never too late. You can start today. You can begin to reconnect with your body gently, with compassion, with curiosity. Not for indulgence, but for healing. Not for shame, but for dignity. Not for fantasy, but for life. Because in choosing to care for this part of yourself, you're not just preserving your health, you're reclaiming your place in your own life story. And that, my dear friend, is what true aging with grace really means.